Welcome to Next Generation Healthcare, proudly presented by Optimal Telehealth. Are soaring health insurance costs for your family or business causing you stress? Tired of the long waits and high fees for a simple doctor's consultation? Then you found your podcast. Next Generation Healthcare is here to empower you to take back control over your healthcare decisions, freeing you from the constraints set by insurance companies. In our episodes, you'll uncover the secrets to circumventing traditional insurance to access direct services from your preferred providers at savings of 40 to 50%. This podcast is a creation of Larry Stout, the visionary founder and CEO of Optimal Telehealth. Now, let's hear from Larry.
Thanks for joining today's episode. We're broadcasting from the Pacific Northwest today. Came up here over the weekend and enjoyed the cooler weather here, but I always like being in Texas. Today, we're going to talk about employers' perspective on healthcare benefits in general and how it applies to next generation healthcare. I'd like the key takeaways for you to be that employers have options to traditional insurance, that the insurance industry is responsible for the inflated costs of healthcare, and that there is a way to have both access to healthcare and control over the costs. From a full disclosure perspective, I want to talk about the word benefit. The government defines the word benefit as meeting certain criteria, and that criteria was established in a piece of legislation called the Employee Retirement Income Securities Act, ERISA, E-R-I-S-A. That's what defines what the government thinks a benefit is. Services in next generation healthcare do not comply with ERISA requirements. So technically speaking, we are not a, quote, benefit. But from a practical perspective, I've not been able to find any word other than benefit that I can use in a conversation like this to describe benefits. So if you'll bear with me, I'm going to continue to use that word as we go through this podcast today. One of the qualifiers or one of the characteristics, I should say, of a true benefit is that the employer can pay for it with pre-tax dollars. That's not the case with next generation healthcare because it is not technically ERISA compliant. You have to use after-tax dollars to pay for it. The savings that you gain with next generation healthcare more than offsets any tax advantage that might be present from using pre-tax dollars. So let's look at this today from two perspectives. One, the perspective of a business that is currently providing employee medical benefits, whether it be group health or in whatever form it is, and those that aren't. Now, again, the IRS defines a small business and a large business. The small business, QSE, Qualified Small Employer, is an employer that has 50 or less full-time or full-time equivalent employees. For the IRS, full-time is 30 hours a week, and a full-time equivalent employee would be two part-time people, say, working 15 hours each a week. That's equal to one full-time employee. So that's how they look at that. Now, with the Affordable Care Act, any qualified small employer is not required to provide medical benefits. But as we know, many do, and that's fine. That's great. As we get into really smaller employees, sometimes it's hard for them to provide medical benefits because they're perhaps too small to qualify for a group medical plan, or they just literally can't afford it. You know, small franchise businesses, a lot of them employ younger people, and they just have to get along without it, even if they would like to do that. So employers are conceptually aware of these services, but they really don't know how they work. And frankly, they assume that virtual healthcare services, medical cost sharing services, are typically for individuals and families. They really don't realize that they're applicable in an employee benefits environment. Next generation healthcare is not a replacement for group health insurance. I want to be clear about that. Whenever we approach an employer that's currently providing group health insurance, I'd let them know up front that this is an additional option for their employees. It's not a replacement for their insurance plan. So it gives their employees better access to services and better control over the cost. Insurance is still the best solution for some people, though. Even though these next generation products are applicable, I'd say, to the majority of anybody in a working environment, There's certainly plenty of applications where traditional insurance is the best solution for someone. And you just pick those out individually, identify those individually. So what are the benefits of next generation healthcare? You get better access to health and you get control over the costs. We talk about access and control again and again. There's lower acquisition costs and much less out-of-pocket expense. So it saves money for the employer and the employee if the employee is sharing in the monthly premium costs, and typically they are. When it comes to financial support, that financial support for major medical services is included in a way that's more consistent with how we actually utilize medical services. And we go into this in more depth in other episodes, but traditional medical insurance can be somewhat arbitrary in the way they pay for medical services. Again, speaking with employers, when I approach them about it, they've always got their guard up because they don't know what this is. They're somewhat reluctant to change. You're always going to meet with some reluctance to change because you're used to the safe harbor of traditional insurance, and it is a safe harbor. But at the same time, employers in this environment, this business environment today, are getting to the point where they're extremely frustrated with the ever-increasing costs. They've got problems with coverage, lack of coverage. Again, their employees not knowing how much out-of-pocket expense they're going to have when they get into situations. Because next-generation healthcare is not compliant, you should be concerned about how you maintain compliance with the Affordable Care Act. That's very easy. As long as you're making a compliant product available, in other words, as long as you're making a group insurance plan available to your employees, it doesn't make any difference how many of those employees, or even if any of those employees, participate in that plan. You are making it available to them. Ergo, you are compliant. You've met all the government regulations for the Affordable Care Act. And if you want to get out of the insurance business, there's a way to do that as well. The IRS has developed a couple of plans called health reimbursement arrangements. There's two different types that might affect your business depending on the size of your business. And we can talk about these more in the future. But if you were to engage with a health reimbursement arrangement, you wouldn't have to go through the annual ritual of renewing your insurance plan and open enrollment process and all those things. So let's talk about how an employer might initially evaluate next generation healthcare. It's common, for instance, it's common to, you might listen to a presentation from a professional such as myself or one of our field representatives. It's common to consult with professionals like attorneys or CPAs, and that's fine. I would never discourage you from doing that. That's always a good practice. However, if you weren't familiar with these services, they may not be familiar with it either, and their professional reputation is on the line. So if you're asking them to make a judgment call on some services, something as critical as healthcare services, that they have no firsthand experience with, they could put their professional reputation at jeopardy by recommending anything other than traditional insurance. That's a safe harbor for them. So you have to keep that in mind. Let's move over now and talk about small employers. The first question I always ask a small employer that's not providing healthcare coverage is, why not? And the answer is always something similar to, it's too expensive, or I can't get good coverage, or whatever it is. On rare occasions, you've got small employers who just say, in my situation, I just don't need to provide healthcare benefits. We get along quite well without it. And that's typically when you're dealing with perhaps franchises that have younger employees and they just think everything's okay. But, my philosophy is good employees are the key to the success, the ongoing growth of any business. So I have been at a business where I, multi-location franchise where we employed a lot of younger people, and I always benefited from having quality employees and taking very good care of them with all the benefits, medical and otherwise. You got to remember, your competitors are not only trying to steal your customers, they're also trying to steal your best employees. Keep in mind there's such a thing as an exit barrier. And when you provide employees with benefits that make them think twice before they leave and go to another job, you've created an exit barrier because they can't get those benefits at whatever this other job is. I've spoken a few times about it, or I've referenced younger employees, and believe me, I've had plenty of experience with hiring and retaining younger employees. They are young, inexperienced in life situations, let's say, and they really, it's often difficult for them to grasp the significance of having access to quality health care. So a health care benefit may not be a priority for them. They're just not interested. They've been healthy and they go on about life. They think nothing's going to happen to them. They don't think they're ever going to be in a car wreck or fall off their skateboard. So they don't think about health care benefits. They want to know about how much flexibility they have in their work schedule and how much money they're going to make. But as an employer, there's a potential benefit to you. Let's face it, everybody gets sick at some time, or everybody has an accident or something happens in their life. And if they have access to immediate primary care medical services, that's a plus. They're going to spend less time if they get sick at night or when they're off work. They're not going to be calling you the next morning saying that, they've got to go to the doctor because they were able to call a doctor at, 4 o'clock in the morning and get a prescription and go on their way, and still she'll treat their condition. So fast, affordable access to primary care is a major focus of optimal telehealth. And I don't think there's nobody will ever convince me that they should, they're perfectly safe and comfortable going without it. If you don't have access to qualified medical professionals that can diagnose and treat your condition, what do? The average person goes out and diagnoses himself using the internet and then purchases off-the-shelf products to treat themselves. Now, obviously, if that doesn't work, they wind up with more serious medical conditions. But when you've got access as an employer to healthcare benefits like 24/365 doctor consultations, access to medical specialists, dermatology services, behavioral health counseling, patient advocacy services, you can afford a package like that for an employee for $15 a month. I mean, that's kind of a no-brainer to provide your employees with that level of service. And then, as they get mature and they have a mortgage or start to have a family, whether it be a spouse or children or whatever, then they get more interested in more comprehensive medical coverage that would look more like insurance. And next generation healthcare could provide that at a very affordable cost, not only for your employee, but for the employee's family. We have covered an abundance of material in this. I know when I go through one of my episodes, I provide a lot of detail. We've talked about how an employer should look at next generation healthcare and how it can benefit them. We've talked about the advantages to the employer and how the insurance industry has inflated the cost of medical services. So in closing, let me just urge you to go to our resource page at optimaltelehealth.com. Share your questions and comments. If you've got something that's going to be helpful to our viewing audience, I'm going to bring it online and onto the podcast, and we'll discuss it openly. I'm always receptive to your input.
Thank you for tuning in to Next Generation Healthcare, brought to you by Optimal Telehealth. Your engagement means the world to us. If you find our content informative, follow our podcasts on Apple, Spotify, or YouTube. We welcome your participation and will review listener input in future episodes. To leave your questions or comments, access additional episodes, or browse our blog post library, please visit the resources page at optimaltelehealth.com. You may also connect with us on LinkedIn, Facebook, or Instagram for the latest insights and updates. We look forward to welcoming you back soon. Your journey towards empowered healthcare continues with us.